Okay, shit. Ready.
Page 29. Okay, accuracy. In new rapid diagnostic test for respiratory infection is evaluated on a population in which 30% of the individuals have respiratory tract infection. The new test 90% the new test is 90% sensitive and 80% specific. Which of the following is the closest probability that an individual will be correctly classified by the test?
Do you know what they're asking you here? Omar?
Yes, yes.
Oh, sorry. Do you know what they're asking you here? Sorry.
They are asking for the closest probability. Uh,
Uh,
they are
I'm going.
yes.
Mhm. Go ahead.
Is accuracy as like accuracy uh, is like what can I say? Is closer to validity and precision.
Oh, okay.
Am I making this too confusing?
I don't know what you say, baby. Maybe I'm wrong. What are they asking? Okay. I was saying because I know this was hard for me, so
Yes,
that's why.
it is hard for me too, but I
Yeah.
am
Yeah.
trying to figure it out
Yeah.
what they are asking for.
Oh, okay.
Uh,
I don't
I know
think.
that accuracy, according to the accuracy, it is like the test should be valid and test should be precise, and that means it should be closer to the bullseye.
Okay. Here they are asking. I'm going to tell you because I
Yeah.
don't think you. Yeah. Here they are asking for the accuracy. They are asking to calculate the accuracy.
Yes.
Mm-hmm.
So, what is the equation of
Um, the equation of accuracy. I don't think that's in the videos. I'm going to tell you because I don't think that's in the videos. Accuracy equals uh,
is the
total.
sensitivity specificity will gonna help? Okay.
Is true positive plus true negative over all of them. True positive, true negative, false positive, false negative. That's the accuracy. You got it?
Yes. So
Okay.
true positive plus true negative divided by all.
Yeah, like true positive, true negative, false positive, false negative.
Okay. So we will make 2 by 2 table and we will disease test. 8 sensitive 90 plus 10 20 plus true positive 20 plus 8 divided by 200. Is it 170 by 200?
You want me to, what do you want me to put? Tell me what do you want me
Okay.
to put.
Uh, what I have done, like
Yeah.
sensitivity is 90%, isn't it? So true positive is 90 and false negative is 10.
False negative. Where's false negative? Right
No,
here,
below, yes, yes.
below. Then,
Uh, and then the specificity, it is 80%. So true negative is 80 and the false positive is 20. So according to your formula, true positive is 90 plus 780, 90 plus 80. Like if you put the what we have got in the formula, like true positive equal true positive is 90 plus 80 divided by 200.
Mhm. What is it?
80 is 0.85, so it is 0.83 would be the answer.
0.83. I think you got the answer, but I didn't do it
But
like you did it.
yes, we should do it in different way. We should do it like 30% and the 70%. Like 30% individuals have respiratory tract infection, so they make the sensitivity of this 30% and they make the specificity of this 30%. We have calculated, like we have got the right answer but in a wrong way.
Okay, but do you get the how they? Okay, let's look at the answer.
Yes, I can do on that way
You can do it on that way. Okay, good, good.
too.
Good.
Okay,
I probably did it that way too. Okay, perfect. Then you don't need to go over this. You got it.
so they
Next.
put like
Mhm.
30%, isn't it? 30% patient with respiratory tract infection. So true
Yeah.
positive, the column of the disease positive, the column of the disease positive is 30, and in here true positive is 27, and by 30. If we make the sensitivity like 30 into 90%, 27. You got my point, what am I talking about?
Yeah, I understood the thing. I was just wondering if you, I understand how they found this.
Okay,
Mm-hmm.
I can make this calculation also. Okay,
Okay. Okay. Next.
yes. A study was conducted to assess the relationship between the serum HDL to level, a subfraction of HDL, and carotid intima thickness as a marker of atherosclerosis. The results revealed a linear relationship between the two variables with a correlation coefficient R equal to minus 0.25. P-value is equal to 0.005. Which of the following is the most appropriate conclusion of this result? Correlation coefficient minus. So positive minus. No. D ruled out. It is statistically significant.
Okay.
Lower level of engineering. Lo- um, higher level HDL low to bond level. I don't know the answer.
You know the answer. Can you eliminate something else?
There is smaller conduction between HDL2 and carotid enzyme. It is not positive correlation, isn't it?
Why?
In positive correlation, coefficient R would be a positive.
Makes sense. Yes. Good. Okay. So we're ruling that out. Anything else where you can rule out?
Higher HDL value tend to relate the lower value non process.
The key is that negative.
Yes,
The difference between the negative and the positive.
negative falls if one goes higher, another goes downwards.
Mm-hmm.
So
And
lower
positive.
positive in case of positive, both goes upwards.
Okay.
Am I right?
Yes, you're right.
So is the answer A?
You think so?
Yes,
Okay. Why is it not B?
because both of them are in same direction. Lower level HDL2 causes carotid intima thickening, and lower level causes lower values of carotid intima thickening.
Okay, that's why it's not C. Okay, good. Why is it not B? Okay, boy.
It is lower. It is not the correlation type. Not
Okay, okay.
okay.
And maybe this word
It cause lower level HDL2 cause carotid intima thickening.
for correlation, do we find the cause?
N-
Can we say, oh, this one causes this?
no
No, we just find relation. One goes
relation.
up,
Yes,
the other one
one
goes
goes
down.
down. Yes.
Okay, so we think it's A. Let's check. It is A. You see, you found it. You have to think a little bit harder. And this is your explanation. We already know that one. Negative means one goes down, the other one goes up. You already said it. Positive means both are going up or both are going down. And then close to zero means
There is
uh,
no relation.
hormonal relation. Close to one or negative ones means the relation gets stronger and stronger and stronger as you get close to one. Make sense?
Yes.
Perfect. Next.
The parents of a neonate recently diagnosed with early onset Pompe disease come to the office for follow-up. They state that while doing extensive research, they state that while doing extensive research on possible treatment for the disease, they found a single scientific report about a new therapy of Pompe disease. The parents request this new therapy instead of standard enzyme replacement therapy. The single report describes a study that included 15 neonates who received the new therapy immediately after the diagnosis. The study reports that the therapy lengthened survival and improved motor development and cardiac function in infants based on a comparison with published prognostic outcomes of the patient with this condition. It does not compare causes of early onset Pompe disease to control. Which of the following statement is most accurate in this condition? Is it option D?
Okay, we can check.
Okay,
Let's see. Yes, it's D. You
okay,
want to read the educational objective?
okay. Experimental studies, randomized control trial can help establish causal relationships, whereas observational studies, case series, only suggest association. Results of observational studies do not provide enough scientific evidence to make clinical decision treating patients with new drugs or therapies.
Does it does it make sense? I mean,
Yes.
okay, okay. Next,
Okay. A cohort study compares the survival rates. A cohort study compares the survival rate of patients with type 2 diabetes mellitus undergoing hemodialysis after two different large for-profit dialysis centers. Patients with type 2 diabetes mellitus receiving hemodialysis treatment at both centers in 520 are followed for 5 years. An excerpt of the results of the study is shown. Center A, uh, 21, okay, p-value 0.02, analysis adjusted. Researchers conclude that compared to Center A, the quality of the hemodialysis at Center B is suboptimal based on the information given. Which of the following potential flaws is the most likely invalidate this conclusion? B and E is rules out, isn't it? It is
you want me to rule
statistically
out,
significant.
you want me to rule out B and
Yeah.
which
E,
one?
yes, these
B
two.
as in boy.
Yes.
Okay.
Follow-up time is inadequate. It is also false. 5 years is a long time. The statistical analysis did not adjust the comorbidities. What does it mean?
Uh,
That it did not adjust for comorbidities.
it means that some people may have diabetes, but other things, like hypertension or whatever, and other people may have just diabetes. Some people may have other diseases on top of the diabetes.
Maybe C is the right.
Okay. Why is it not D, as in dog?
Significantly underpowered. Power is based on the what can I
Hmm.
increase power increase like population. In here 520 people is lot, isn't it?
Good, good. So it's not this one. So you think it's C? I'm actually between C and B.
Okay.
But yeah, I'm leaning more towards C. But just to let you know, a study can be clinically significant is not the same thing as statistically
Statistic
significant. Statistically means this, the p value.
p value.
Yeah, so here you're right, it is statistically significant, but a study can be statistically significant and not be clinically significant. And vice versa, a study can be clinically significant and not be statistic. We've already found a question where they were different. So just trying to, just in case you know, I don't want you to think they're both mean the same. But let's check. So it's C. You were right, the comorbidities. Let's, oh, there is, yeah, there is an explanation. Go ahead. Yeah, read it.
Confounding bias occurs when a study does not control for extraneous variables independently related to both risk factor independent variable and the outcome dependent variable. When not controlled, confounders may mask the true effect that the independent variable has the dependent variable, which may lead to a false conclusion. Statistically significant results that are truly invalid. This cohort study compared 5-year survival rates outcomes among patients with type 2 diabetes mellitus undergoing hemodialysis at two different centers. The study adjusted control for age, sex, however, it does not adjust. One second. One second.
Okay, next.
Yes.
Did we finish? Okay.
Okay, ROC curve. I can see you screen.
Oh, sorry, didn't share. Now,
A study evaluated the predicted a study evaluated the predicted effect of inflammatory molecules of intercellular adhesion molecular ICAM level on the prognosis of acute ischemic stroke. The study included 300 patients with acute ischemic stroke who were treated at three local hospitals. Demographic data were collected and blood samples were obtained within 24 hours of admission to detect the clinical indicators. The functional prognosis was measured using the modified ranking scale MRS 3 months after the score. Poor prognosis was defined as modified ranking score 3 or more than 3. Enzyme-linked immunosorbent assay used to determine serum ICAM level. The receiver, the ROC curve analysis for serum ICAM level in AIS acute ischemic stroke patient is shown below. The label points in the ROC, the level points in the ROC graph represent four theoretically possible cut point values. Which of the following describes the cut point value level E? The labeled points of the ROC curve represent four theoretically possible cut point values. Which of the following describes the cut point value labeled E? This E.
They both is right here. Sorry, I'm putting it there.
All tests are negative.
Okay, that's what you think. The answer.
Yes.
Yes. It's all positive yet at first negative. Want to read the explanation?
Yes.
Oh, there is explanation. Good. Mhm.
What have you what will you give?
I thought like you. I thought it was yeah. All things are negative. Yeah.
Okay. For a test with 0% sensitive, 0% specific, all positive results are false positive. 0% sensitive, 0% specific, all positive test results are false positive. A ROC receiver operating characteristics curve for a given diagnostic test plots sensitivity on the y-axis and uh, 1 minus specificity, or equivalently 100 minus specificity is on the x-axis. The curve can help determine the best cutoff threshold, the value that determines if a given test result is positive or negative to use depending on the optimal desired parameter for sensitivity and the specificity. Sensitivity represents the rate of true positive. Specificity, test ability to correctly identify patients without disease, and negative represents the true negative. Therefore, a 1 minus specificity represents the rate of false positive. I don't understand how they made this conclusion. Uh,
Hmm. False positive. The only thing that makes sense here is because specificity is true negative over true negative plus false positive, right?
yes,
So if the point is right here, then let's say the point is right here, then the specificity is low. Wait, is it low? This is here the specificity is,
1 equal to 0, isn't it?
yeah, here the specific, because the false positive will be high, so the specificity will be low. So here, as we go this way, the specificity gets high. As we go to this side, the specificity gets high, and
Higher.
as we go up, the sensitivity
Sensitivity
gets
is higher.
is higher. So so here I'm thinking this, here the false positive will be super high, so the specificity will be low. Does it make a little bit sense?
No,
Okay, okay, okay. Here they're telling you the answer is all test results are false positive. Okay, specificity equals
true negative divided by true negative plus false positive.
negative,
So
to
if true
negative
negative is 0,
plus false positive. One minus specificity. Mhm. One minus specificity is the false positive.
okay,
If one minus specificity is the false positive. That's why as we go here, the specificity increases and the false negative decreases. But as we
false,
go there, so this 100, as we go this way, the false positive increases and the specificity decreases.
decreases.
Yeah. So if we go all the way to the end, the false positive will be super high, the highest level, and the specificity will be super low, the lowest level.
Yes, it makes sense. Can you say it again?
Okay, okay. No, what about you saying it? I forgot what I said. I mean, it made sense. I was saying it, but I forgot what I said. Can you
Okay.
say it?
Ye
Mhm.
yes, you say it like that, that uh, if we closer to the uh, x-axis, like in the 0,
Uh-huh.
it is more specific. If
Mm-hmm.
we go to the closer to the y-axis, like E point,
Mm-hmm.
then it is less, then it is 0% specific.
Okay.
Okay. So if according to specificity, true negative divided by true negative plus false positive.
Mm-hmm.
So if all the all the tests are positive, or if all positive test, then so it is very specific, isn't it? So if there is all positive test, so there is no true negative, so true negative is 0 and false positive is the only answer. So specificity goes up and positive false positive also goes up. Does it make sense?
No, because you just said specificity goes up and false positive also goes up. And that's not true. How
True,
can they
yes.
both go?
If specificity goes down, then false positive goes up. It's vice versa.
Okay. So here what will happen to specificity?
In here, specificity is higher,
And
and
what's happening with false positive?
there is no false positive. So false positive is lower.
And here,
In here, specificity is lower, but false positive is higher.
okay, perfect, you got it.
The line does not make sense that all positive test results are false positive.
Where are you
Okay,
saying it?
okay. Now I
Oh,
found it. Okay.
oh, okay. Did you finish reading? I don't know if you finished reading.
No,
I think you finished. Uh-huh.
in the ROC graph shown that the cut point in the ROC graph shown the cut point E has the rate of true positive sensitivity is 0. It lies on the x-axis. The rate of false positive 1 minus specificity of 100%. This means that at the cut point there are no true positive. All results are false positive. In other words, all positive test results are truly false positive. Given 100% rate of false positive, the cut point would mislabel the healthy individual as sick, 100 as sick, 100% of the time as sick, 100% of the time. Okay,
I understand why this is the answer, but I don't understand why C is not the answer.
all tests are negative.
Because okay, okay, fine. Because sensitivity will be all results are true positive. Low sensitivity will be okay, okay. Low sensitivity will be all results are so sensitivity goes with false negative, right? Sensitivity goes with false negative. Okay, so I guess here if it was low, that would be all results are false negative. Okay, never mind. Never mind. Got it. I think I got it. Okay. Okay.
Okay,
Next.
next, yes. In recent years, in recent years, more people have diagnosed with leukemia town A and town B. Which of the following study design would be best suited to the determine whether the town location is related to the apparent difference of the leukemia incidence in two towns? Is it ecological? They are
Mm,
looking for the location, the leukemia regarding that particular area.
okay,
Ecology.
so you think it's ecological. Okay. I'm between clinical trial.
It is not.
No, I don't
I
think
think
clinical
that it
trial.
is not clinical trial.
It's not clinical trial, right? Doesn't make sense. But I guess I'm between. Ah, yeah, I guess ecological and case control.
It's like uh,
Yeah, let's.
if you live in our country, like there is chance of having. Am I right?
Uh,
Let's assure first, then say something.
don't think is a. I don't think. I think it's cohort. The
Okay.
answer. Let's read it. Let's
Okay.
let's read. Yeah.
Incidence is defined as the number of the new cases of a disease arising in at-risk population over a specified time. Subjects with subjects without the disease are followed over a period of time to discover how many eventually develop the disease. A cohort study is an observational study in which the groups are chosen based upon presence or absence of one or more risk factors. All subjects are observed over time for development of the disease of interest, allowing the estimation of incidence within the total population and comparison of incidence between groups. In this example, the town of the residents is the risk factor of the interest and leukemia. is the disease of interest. In this example, the town of residence is the risk factor of the interest, and leukemia is the disease of interest. Residents of town A and town B would be followed for a period of time. The incidence of leukemia determined for each site. Comparing the incidence between two towns would allow the determination of the relative risk for developing leukemia in town A compared to town B. These would be an example of prospective cohort study. Retrospective cohort study review Retrospective cohort studies review records to determine the risk incidence of a disease of interest in population of subjects, population of the subjects chosen based on the presence or absence of the risk factor. I don't understand.
Does it make
It does
does it make sense?
no. Can you please explain?
They're saying it's cohort because you already know cohort. You start with exposure and then you check for outcome. So
Yes.
the exposure here will be the town, and the outcome will be leukemia. So you pick people with exposure, people with not exposure. I guess exposure will be the two exposure will be town A, town B. That will be exposure and other exposure, I guess. And then you follow them for years and you see they develop the outcome, which is leukemia. The question was asking you what is the study design that will be the best one to determine whether the location, so if the town is the one that is causing the disease.
Okay.
Yeah. So is the town in the disease the if you do ecological thing, you cannot make conclusions based on patients. So you cannot say like patients in this town are more likely to blah, 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 blah. You cannot talk about the patients if you do ecological. You get what I'm saying? So it
Yes.
will be, yeah, it will be hard to make a conclusion just if you do just the ecological. They're asking you what would be the best study here for to make conclusions. So if you do ecological, there will be a lot of like you cannot make conclusions on the patient. I was with case control because I knew it was between case. I knew it wasn't ecological. I knew it was between case control and cohort, but I didn't know if they wanted you to start. They wanted me to start with the outcome and do exposure, or they wanted me to start with exposure and do outcome. Because here it would take a long time. You have to follow them until they develop leukemia. That's like years or something like that. So I didn't know, you know. But I guess, yeah, I guess, yeah, they don't care if you have to follow them for years at this point. That question was a bit tricky too.
True.
Yeah, that question is a bit tricky because we are not used, we are used to exposure being smoking, not smoking, things like that. We are not used to exposure being a town, like a location. I think that's what made it a little bit tricky. Okay, makes a little bit of sense.
Yes.
Okay, next.
I was too firm in ecological study.
It's okay. It's it's okay. But it makes sense because that's what I'm saying because they say location. It
Yes.
makes yeah, yeah. What you say, yeah.
Okay. In a large population with almost negligible growth rate and minimal migration, the incidence of type 2 diabetes mellitus is 3 cases per 1,000. 3 cases per 1,000 individuals a year and has been stable for the last 30 years. However, the prevalence of type 2 diabetes mellitus has increased progressively over the same period. Which of the following is the most likely explanation for this trend over time? Uh, okay, it's D.
Mhm.
D. D. Donkey.
D as in dog.
Yes.
You think so? I think
Ye-
it's C.
Okay. Okay. Wait.
Let me check. Okay.
Improve, improve disease management. Yes, it's C. C. Sorry,
Why is it not D?
it's C as because there is increased prevalence, isn't it? The increased prevalence, that means lots of people are living long because of the treatment. That's why they so improvement of the disease management is improving. Like previously, the people with diabetes usually die early because there are not new drug like now, isn't it? And increased diagnostic accuracy will not increase the prevalence.
Why?
It also, it can also increase the prevalence. Okay, why it is not? It can also increase the prevalence because
What does
it also,
diagnostic accuracy
oh,
means?
sorry,
What does diagnostic accuracy means?
like you diagnose uh, diabetes mellitus accurately.
Okay. So will that increase the prevalence?
It increase the incidence, isn't it?
Perfect, perfect, perfect,
Okay,
perfect. Let's check. It is C. I think you got it.
okay,
With the definitional objective.
okay. And increasing prevalence but stable incidence of a disease can be attributed to factors that prolong the duration of the disease, improve quality of care, and the disease management. Okay,
Make sense?
yes.
Okay. This is from the video. I think it was just the definition of prevalence and incidence. Prevalence, number of patients with the disease at one point in time. Yeah. And if prevalence increases, I don't know what he said about this. Incidence among patients with risk, patients at risk, so people that don't have the disease yet. Number of patients who develop the disease over a period of time. You can increase incidence by screening more, I guess, and you can decrease its incidence by preventing the disease from happening at the first time, by decreasing the disease from happening, be vaccination or public health initiative. Or I remember, he said you can increase the prevalence by increasing the incidence or by increasing the survival, so a good treatment. And here he was giving you an example right here from this. He told you if you want to, can you find the prevalence at 12 months? This is 12 months right here. What am I doing? 12 months right here. So at this point, what is the prevalence? The prevalence will be number of patients with the disease. So it will be from patients in the population. This one is in the population. This one is in the population. This one is in this one. So four people four of them have the disease, one or two, so it's 2/4. Does it make sense?
Yes.
Okay. So then he asked you to find the incidence in the first 12 months. So from here to here. Remember, incidence is a period of time. Prevalence is one point in time. So yeah. So incidence again, he said it was from the patients at risk. So people that don't have the disease yet. Which one developed the disease over that period of time? Am I saying it right? Yeah, I guess I'm saying it right.
You are saying
So
right. No problem.
So from people that don't have the disease, one already has the disease. So this one, I guess, already have it. Yeah, I guess we have six people that can develop the disease from at this period. All of them can develop at the beginning of this period. Nobody has the disease, and at the end of the period, how many people have it? One, two, three, four. Four have it. Does it make a little bit of sense?
Yes.
Okay, perfect. So if it makes sense, give me the prevalence and incidence here.
How many months? 2 years. Five patients are followed for 2 years for development of a disease with clinical courses and determined the values. Prevalence, a prevalence 12-month incidence between B and 18 months.
Sorry, between I think that's 6 and 18 months. Sorry, so six.
Okay,
I don't know why.
six. Five patient. Five patient. 12, 1, 2, 3, 4. Prevalence is 4 by 5,
Prevalence is 4 by 5.
and
Okay.
uh, and the incidence is 2 by 5.
Incidence is 2/5. Wait, 2/5. Wait, let me calculate it myself. Make sure. Prevalence from the people in the population. I got okay. Incidence is you say from 6 to 18 people at risk. Oh, sorry, 6 to 18. Cases. Okay, I got different than you. I got 3/4 for prevalence and 2/3 for incidence. Let's check.
Okay.
So no, you did not get it.
Yes, I did not get it. So
Okay.
okay, explain.
Okay.
So prevalence. Prevalence means that the patient with the disease at a point of time, isn't it?
Mm-hmm. What
So
is
the
that?
time in here, the time frame is 0 to 12 months.
At that point in times mean there is 0 to 12 months mean a period.
Yes.
Means a period. So from 0 months to 12 months. Point in time just mean today or just at 12 o'clock or just it just mean one point. You're not looking from 7 in the morning to 12 o'clock. You're not looking from January to February. You're just looking in the 16th of August of 2000. Just that point.
Okay.
Mhm. Okay. So you have at one point in time, and you say prevalence is the number of people that have the disease at that point in time.
I don't get it. What you have. told me now.
Okay, okay. Should I do it with this one? I guess I'll do it with this one. So prevalence. No, I don't remember seeing a question like this. I remember finding prevalence in incident, but I don't know if they all. I guess fine. I'll do it. Prevalence at 12 months. We just put the line at 12 months. There is no before, there is no after. Just exactly at 12 months. How many people with the disease at 12 months? That means that, oh, maybe that will help. This first point means when the patient developed the disease. And
Yeah.
this last point means when the patient died. So patient
Yes.
developed the disease, live with the disease, and die. Patient developed the disease, live with the disease, and die. Does it make sense?
Yes.
So at 12 months, we have only two people that were living with the disease. Does it make sense?
Yes. Now.
Yeah, yeah. Sorry. He did say that on the video. Yeah, he said that on the video. So we only have two people that live with the disease. So it makes sense the two at the top, right? The two here, the people
Yes.
that have the disease at 12 months is only two people. The denominator, that's the numerator. The denominator is the people that were in the population at that time. So prevalence is the number of people with the disease over the people that were living in that are living in that population, whatever. So here, um, so here we have one. No, this one is already dead, so it's not even living in that population anymore. So don't worry
This
about
one
that.
is dead and four one
He's
is
dead.
dead too.
The third one is dead. So there are
Yes.
only
Only
one,
two.
two, three
Two
people
people.
that are okay. There are only two people that have the disease at this point.
Yes.
But these two other people are still living in this population, right?
Yes.
Yeah, they are living. They just don't. They just have not gotten the disease at 12 months. They come to get the disease later, like at, I don't know, 13 months or whatever. I don't know. But they are living in this population. Does it make sense?
Yes.
Okay. So you got prevalence. Incidence. Now, incidence is the period of time, is what you were saying from 0 months to 12 months. So incidence is not one point in start. It's not exactly at 12 months. It's from 0 months to 12 months, from 12 months to 24 months, from January to February, from whatever, 7 a.m. to 12 p.m., whatever, is a period of time. So in the definition of incidence is among the patient at risk. So among the patients that already have the disease, number of patients who develop, no, sorry, never mind. Among the patient at risk, so among the patients that don't have the disease at the beginning of the 0 months, which one developed the disease over that period of time, 0 to 12? So at the beginning, everybody's healthy or whatever, At the beginning, people that don't have the disease, how many of them develop the disease at the end of the 12 months? So we have one, two, three, four, six people at the beginning of the 0 months, at the beginning of the period. So that's the denominator. From 0 to 12, how many people develop the disease here? You have one develop the disease. I mean, he died in between, but he developed it during that period. So this is one. You have two that developed the disease, and he's still living even after 12 months, but he developed it during that period. So we're just trying to find the people that developed the disease during that period. You have three didn't develop. He developed after 12 months, so he's not inside this period. Then you have four. Four, yes, he developed it during that period of the. So you have one, two, and four. So three people. Five also he developed it during that period. So you have one, two, four, and five. Four people. And six he developed way after the period, so we don't count them. So you have four people over the six people that were at risk that were whatever that didn't have the disease at the beginning. So four over six makes a little bit of sense.
Yes.
Okay. So now can you tell me here without looking what is the answer without looking at your thing?
Yes.
Mhm.
Okay. Prevalence of 12-month. Prevalence. Prevalence for the phone number he died, and one, two, three people. Three by four.
Okay.
And incidence. Incidence is 2 by 4.
Why? Where does the two come from?
Uh, Number of two
So we are looking at what period? 6 to
to
18.
18. Sorry. So
Uh-huh.
2 by 3 or 2 by 3.
2 by 3. Perfect. You are right. I think you got it.
Can you tell me the incidence again? I just forgot these things. The
Oh,
incidence part.
is among the patient at risk, so among the patients that don't have the disease, which one developed the disease over that period?
So in 0 to 18, sorry, 6 to 18 month.
Sorry, 6 to 18 years
Yes,
months.
6 to 18 month. So 2, 3. Like 1, 2, and the 5. These three actually comes in the among these three.
I, I don't know. Maybe I'm not understanding what you're saying. Sorry.
The incidents. Can you just elaborate these incidents? I found I got the prevalence, but I forgot the incidents.
From the patients from 6 to 18,
Yes.
the patients that don't have the disease that develop it, you have this one. Sorry, let me put the line.
Okay,
Maybe it will.
incidence is number of the new cases, isn't it? If the patient
Yes.
is previously diseased, they are ruled out. So 2 is ruled out on that basis. 4 is out
Okay.
of the question, and 2 is ruled out on that basis. In 1 and 5, in these two, in these two, they actually the disease started within 6 to 12 months. That's why the incidence is 2 by 3.
That's why they see. That's why two is in
2,
the
yes.
numerator.
And
Why
how?
do you know why two is in the denominator? Do you know where the three coming from?
3 comes from uh, 1, 2, and 5. This one would be in the this one is added. It is in between this timeline. That's why it is added.
I don't understand. What do you say? It comes from which patient?
Like one patient number one who falls in
Okay,
these
patient
categories
number
and
one.
died in this category, isn't it?
Mm-hmm.
In this
Okay.
patient, yes.
And which other patient?
In between 6 to 18 months, there is a
Yeah.
patient who has like disease and he died within the 6 to 18 months. So they should be considered in the incidence.
I don't understand what you're saying. You said two comes from these two right here, and the thing comes from this one, patient one and patient five, right?
Yes.
That's what you told me. So I'm asking you, these three comes from which patient?
Oh,
How did you get three here?
oh, this three comes from patient number two.
Okay. So incidence is among patients at risk. So among patients that don't have the disease already. So two, before we start, two already has the disease before we start
Yes.
6 months. So can he be at risk of developing the disease?
No,
No, because he already
he
has it.
already has a disease.
So who are these three patients that you put at the bottom?
Is it comes from the three?
From three, okay. Who else? You gave me one, three. Who else?
1, 3, and 5.
Five. Okay, got it. Does it make sense?
Yes.
Okay. Does that feel? I feel like this is an easy question that can actually come on the exam because it's pretty easy to figure
This
out.
question is easy. I am making things
Yeah,
complicated.
yeah. So I'm like, just in case it comes, it's an easy point. Should be okay.
Okay, next. You are,
Okay.
yes, you are studying patients with diabetes. How will the following changes impact the prevalence and the incidence? Better treatment increase the prevalence, and
Mm-hmm.
incidence is normal, like incidence does not change.
No change in incidence. Yeah,
Increase
food.
funding for community exercise and healthy diet. Increase funding for community exercise, and it will decrease the incidence,
Decrease the incidence. Uh-huh.
and it will increase the prevalence.
Increase the prevalence. I'm just writing what you're telling me. Okay. Last one.
Lowering HbA1c cutoff 6.5 to 5.5. It will incidence will not gonna change in here.
Okay. No change in incidence.
Okay, and
So that
if we increase the cutoff, then there is increased prevalence.
increase prevalence. Oh my God. Increase prevalence. Let's check. So you said if we increase the treatment, if we do better treatments, it will increase prevalence and no change in the incidence. You get. If we increase the funding for community exercise and healthy diet, will decrease the incidence, but that will decrease the prevalence.
Prevalence.
You said increase the prevalence. It will decrease the prevalence. Because if you are decreasing the incidence, you're automatically decreasing the prevalence kind of thing. Lowering the cutoff value from 6 point something to 5, it will increase the incidence and increase the prevalence. Okay, does it make sense?
Yes,
Okay.
it makes sense. Okay, next.
Next.
Population of 1000 among 250 having diabetes at the beginning of the study. Over the 12 months, 100 patients with diabetes die and 100 patients develop diabetes. Over 12 months, 100 patients with diabetes die, 100 patients develop diabetes, and 150 without diabetes die. 100 patients with diabetes die, 100 patients develop diabetes, and 100 patients without diabetes die. Incidence is number of the new cases, like 100 divided by 250.
You say incidence is, you say incidence is 100 divided by, you said 250?
Yes,
Okay.
it's number of new cases divided by population at risk. It is incidence, and prevalence is number of all existing cases divided by total number of 250 by 1000 prevalence. Am I right?
You said 250 by 1000. Let's check. No, you are not right.
You are, I am totally wrong.
Okay, it's fine. Let's go. You said prevalence at one point in time. So what is our one point in time? Uh, I guess 12 months. Oh, sorry, they gave it here. Never mind.
Yes, 12
12
months.
months. So it's number of repeated. You said it was people with the disease over number of people in the population. So at 12 months, we started with 1,000. And at 12 months, 250, 100 patients have died. So 1,000 minus 100, we have what? 900?
Yes,
Okay, let me get my calculator because I
and
cannot do that.
150 also died due to diabetes.
That's
And
900
yeah,
die and 100 blah blah and 100 with the diabetes die. So minus 150, 900 minus 150, you have 750. So at 12 months, there is only 750 people in the population. So that's 750 at the bottom. Makes sense. And
yeah,
the numerator is the number of people that have the disease at 12 months. So we started with 250 having the disease at the beginning, whatever. 12 months to 100 people died from the 250. So we had 150 plus 100 people what were they? Develop the disease. That yeah, 100 people develop the disease. So 150 plus 100, that is 250. Does it make sense where it's coming?
yes.
Okay. So we got prevalence and incidence. What was the definition of incidence?
Number of new cases 100
Over what?
divided by population at risk,
Okay, so population that don't have the disease. Let's start with population that don't have the disease.
like
We started at
1000 minus 250. Yes,
we started with 1,000 that at the beginning at the 0 months, and at the end of 12 months, what we say, people that don't have the disease. We had this 100 died, so we have 900. 100 patients developed the disease, so we can take whatever that one out. And then, am I doing it right? Yeah, 150 out that died also. So 900 minus 150, that's 750. This doesn't make sense for me. Wait,
it
a
does.
hundred. The number of people that do not have the disease over 12 months. We know the 100 where it comes from because there's only 100 patients that develop diabetes. That makes sense during the 12 months, right?
Yes,
The 100 makes sense. The 750 during the 12 months, we started with 1,000
and it started with a
population.
thousand and 250 having the diabetes at the beginning of the study. Then lots of things happened.
Sorry, do you understand where the 750 comes from? Is that what you're trying to say?
Yes,
Okay, tell me then where it comes from.
1000 minus 250. They are
Mm-hmm.
excluding the 250.
Okay. They already have the disease at the beginning. You say you got it. You got it. Okay, next.
A large study. A A large study is conducted to assess the association between the altitude of life expectancy and life expectancy. Researchers obtain data on life expectancy at the country level from the Centers of the Disease Control and Prevention and collected altitude from US Geological Survey. A regression A regression was used to model the association between the altitude and the life expectancy at the country level is 3064 countries in the contiguous US, while also controlling the several well-established cohorts. Which of the following best describes the design of the study? Design. Altitude and life expectancy. Is it ecological survey?
Okay. You think it's ecological study, you mean?
Yes.
Okay. Let's check. You are
Yeah.
right. He's like, yeah, that's funny. Okay, you can read the explanation.
In this study, researchers collected country-level data on life expectancy from cities and prevention control. Additional data from US Geological Survey to determine whether altitude is associated with the life expectancy. Altitude is associated with the life expectancy. Using population level countries did rather than individual level data as a unit of analysis in such a manner is consistent with ecological study. Ecological studies are useful for generating hypotheses but should not be used to draw the conclusion regarding individuals within this population because statistical relations observed in population may not hold true within all subgroups that make up that population. For example, the study may show that altitude is significantly associated with longer life expectancy at the country level, when in fact altitude is significantly associated with shorter life expectancy in certain group with the country. People with chronic obstructive pulmonary disease, this apparent paradox is called ecological fallacy.
Makes sense.
Yes,
Next. So, I will look at
B2A,
the answer.
point B2A. The sensitivity of the
So,
screening will change. The sensitivity.
we're reading 33 now, or where are you?
I am reading the 33. I am looking
Okay.
for the answers. Okay, I
Okay.
am reading the question first.
Mhm.
Researchers at a large pharmaceutical company discovered tumor-specific antigen present in high quantities in the serum of the patient with pancreatic cancer. A study is then performed to evaluate the serum levels of the tumor marker in patients with or without the disease. The following curves are generated using the results of the study. The drug company decides to utilize the newly discovered tumor antigen by creating a screening test for pancreatic cancer. During preliminary design, the cutoff for positive or negative test is set at point B. If the cutoff point is moved from B to A, the sensitivity of the screening will change. Which of the following? Okay, in the disease, write true positive. The bigger disease one.
True positive.
If
Disease.
this is
Uh,
diseased, yes, it is true positive, and the healthy is true negative. Everybody keeps their last name like false negative uh, in the
what do
healthy,
I mean? Right here or right here? What do I write?
like in the left, in the
Oh,
near to a here.
right here or right
Yes,
here? Right here.
yes, yes.
Okay. So I write false negative.
Negative.
Just okay. False negative.
And
And then right here, like
false
what is
positive.
false positive?
So, so you are going from B to A, isn't it? From B to A. So we are smashing the false negative and increasing the false positive. So there is increased false positive and decreased false negative. And let's go to the sensitivity equation. Sensitivity is true positive divided by true positive plus false negative. So false negative goes down, so sensitivity goes up. So
So you want to say
increase
increase?
sensitivity, yes.
Okay, let me check my way. Let me do it because I don't know how to do it like yours. So here we have B, sensitivity will be people that is positive. So over here, over people with the disease, so it will be here. If we move from B to A, people that is positive, over people with the thing. Okay, so it will increase. I agree with you. It increases. Makes sense. Okay, next, and I think this is the
Okay,
last one, or not, maybe not the last
okay, last question.
one. Not sure.
A group of researchers conducted a case control study to examine the association between the epidermal growth factor gene polymorphism and colorectal cancer. The study determined the EGFA61 polymorphism by PCR restriction fragmental length polymorphism method in 350 colorectal cancer cases and 350 controls. A different group of researchers decided to replicate the initial case control study and recruited 700 colorectal cancer and 700 control. Which of the following is the major advantage of the replication study? Recruited 700 colorectal cancer, 700 control. Is it C
Okay, you think it's C.
or is it D?
Okay, so can we eliminate all the other ones? You want me to eliminate all the other ones?
Yes, you eliminate all the other ones.
Okay, then tell me why you think it's the other, why you think it's one, and why you think it's the other. Why do you think it's C?
If we add new patient and new control, it will there is more probability of uh, more sensitivity and specificity. It doesn't make sense actually. Does it make sense?
You asking me? you ask, I'm waiting on you. I don't know. You're telling me, you're explaining to me, and then you're telling me it doesn't make sense. Okay, why is it D?
Type 2 error. Type 2 error. Low, type 2 error means the investigator thinks there is no abnormality, but there is actuality, there is an abnormality, isn't it? So there is investigator think that there is no disease, but actuality there is a disease like that. So if we recruit more and more people, it will increase the power and it will decrease this thing.
Yep, you're right. I get what you're saying, D. Okay, I'm with you on D. Let's check. It is D. I like how you explain it. I know it makes sense in your mind. Yep.
Okay.
And read the applicational objective.
Studies with a larger sample size have greater statistical power and consequently a lower probability of type 2 error than studies with a smaller sample size.
Does it make sense?
Yes,
Yeah. You cannot find sensitivity specificity here. They didn't give you not true positive, not true negative, not false positive, not false negative. They didn't give you the test. They didn't give you like you cannot. There's no way of finding sensitivity specificity. Okay. Next.
yes. Oh, positive predictive value. Hmm. Positive predictive value of screening under this study. Which of the positive predictive value? Okay, studies undertaken to evaluate a new serological screening test for the diagnosis of the tuberculosis infection. In this study, 1,000 people were randomly selected from the population and given the new diagnostic test and positive and the negative test result. Each study participant also given each study participants also given the gold standard dependent procedure to determine the true infection of the individual. The findings are as follows. Which of the following is a positive predictive value? We okay, positive predictive value of the screening under this study. Screening under this study. Positive. Is it one?
Huh?
Wait, I am thinking. Positive predictive value is true positive divided by true positive plus false positive, isn't it? So 130 by 190. 130 divided by 190.
Okay, you think it's this one?
Yes.
Okay, so let me do it. Positive predictive value, number of people that have the disease divided by people that tested positive for the disease. So yeah, I agree with you. Okay, last question. I think, not sure at this point. Yeah, I think so.
Okay. Now, an open label randomized parallel arm active study evaluated the safety and the efficacy of a continuous infusion of the potassium chloride versus an existing intermittent infusion of the regimen is critically ill. Critically ill adults with plasma potassium concentration between 2.5 and 3.8. The primary outcome was the difference in mean plasma potassium concentration over time between the two groups. The study recorded a difference in mean plasma potassium concentration over time between groups of 0.2 millimole per liter. A 90% confidence interval showed that the difference was statistically significant. What would be the effect on the width and the significance and the confidence interval if the confidence interval increased to 95%? Confidence interval increased from 90 to 95%, is it? Increased confidence interval. Is it A?
Okay, you think it's A. Let me see. I think is with his significance level. It's with increase definitely. Significance level. The width, what would be the effect on the width and significance level? Yeah, I guess I'll go with A. Love is D. Significance level cannot be determined. We can read the educational objective.
A confidence interval with a greater confidence level is always wider than confidence interval with a lower confidence level for the same data. The A confidence interval or a significance or difference in means is significant if the interval excludes the null value, and it is not significant if the interval includes the null. It does. I don't understand this question last.
You understand the the null value of pi.
Sorry.
You understand the null value. It includes zero, so the null value is included, so it's not statistically significant. You understand that part?
Yes.
Okay. So the part that, which is the part that you don't understand, because you got the width. If you increase the confidence interval, then you, I think we found a question before. When you increase the confidence interval, you also increase the confidence level. I think we found a question. So that's what the width is increasing. Now the significance, I don't understand what the significance means. They didn't really explain it here. But the confidence interval and the confidence level, they always increase and decrease together. We already found a question that was explaining that. Um, the significance level, I guess it doesn't change, or I don't understand what the significance level means. Oh. Never mind. They're asking if it's statistically significant or not. Okay, so he did the study. He gave you a confidence interval, and he said the confidence interval 90% showed that the study was statistically significant. So he gave you that. He didn't give you the, the 3 to 4, the 2 to 4 thingy. He didn't give you the interval actually. So now he's saying that, oh, now I'm giving you a bigger confidence. Now I'm increasing the confidence level or whatever, instead of 90, 95, basically. You already know that the width increases. If the confidence interval increases, the level also increases. So here we went from 90 to 95, so the confidence interval increases, so the level would increase. So that covers this. But the significance, the statistically significant, you cannot determine it because they never gave you, the interval. They didn't even give it to you here. So how can you determine if it's statistically significant or not? You don't have the interval, so you don't know if it includes zero or includes one. You don't know. Does it make sense?
Slightly.
Little slightly. Like, how can you determine the statistically significant here on this question?
No, no way. Okay. Okay, I
That's
got
the
it.
point. Yeah, you cannot because they didn't give you no interval
Yes.
thing. Yeah, so you cannot determine. And the width, you got what the width is increasing, right?
Yes.
Okay, perfect. Then we are done
Done.
now. Yes.
We will start we will start 2021 after break.
Okay, perfect.
Okay.
See you after the break.
Okay, bye bye.